Hi everybody, this video of mine is about a very dangerous condition known as heat stroke. Nowadays it's a summer season in so many countries, so that's why I'm making this video. This is a condition caused by your body overheating, usually as a result of prolonged exposure to or physical exertion in high temperatures. The most serious form of heat injury, heat stroke, can occur if your body temperature rises to 104 degrees Fahrenheit or 40 degrees centigrade or higher. The condition is most common in the summer months. Heat stroke requires emergency treatment. Untreated heat stroke can quickly damage your brain, heart, kidneys, and muscles. The damage worsens the longer treatment is delayed, increasing your risk of serious complications or death. Now I'll tell you the symptoms. Heat stroke signs and symptoms include high body temperature. A core body temperature of 104 degrees Fahrenheit or 40 degrees centigrade or higher obtained with a rectal thermometer is the main sign of heat stroke. There could be altered mental state or behavior. Confusion, agitation, slurred speech, irritability, delirium, seizures, and coma can all result from heat stroke. Alternation in sweating. In heat stroke brought on by hot weather, your skin will feel hot and dry to the touch. However, in heat stroke brought on by strenuous exercise, your skin may feel dry or slightly moist. Nausea and vomiting. You may feel sick to your stomach or vomit. Flushed skin. Your skin may turn red as your body temperature increases. Rapid breathing. Your breathing may become rapid and shallow. Racing heart rate. Your pulse may significantly increase because heat stress places a tremendous burden on your heart to help cool your body. You may also suffer from headache. If you think a person may be experiencing heat stroke, you should seek immediate medical help. Call your local emergency numbers so that person gets treatment as soon as possible. You should take immediate action to cool the overheated person while waiting for emergency treatment. Get the person into shades or indoors. Remove excess clothing. Cool the person with whatever means available. Put in a cool tub of water or a cool shower. Spray with a garden hose. Sponge with cool water. Fan while misting with cool water, or place ice packs or cold, wet towels on the person's head, neck, armpits, and groin. Now I'll tell you the causes of heat stroke. Heat stroke can occur as a result of exposure to a hot environment. In a type of heat stroke called non-exertional heat stroke, which is also known as classic heat stroke, being in a hot environment leads to a rise in core body temperature. This type of heat stroke typically occurs after exposure to hot, humid weather, especially for prolonged periods. It occurs most often in older adults and in people with chronic illness. Strenuous activity. Exertional heat stroke, that is second type of heat stroke, is caused by an increase in core body temperature brought on by intense physical activity in hot weather. Anyone exercising or working in hot weather can get exertional heat stroke, but it is most likely to occur if you are not used to high temperatures. In either type of heat stroke, your condition can be brought on by wearing excess clothing that prevents sweat from evaporating easily and cooling your body. Drinking alcohol, which can affect your body's ability to regulate your temperature. Becoming dehydrated by not drinking enough water to replenish fluids lost through sweating. Now I'll tell you the risk factors. Anyone can develop heat stroke, but several factors increase your risk. First is age. Your ability to cope with extreme heat depends on the strength of your central nervous system. In the very young, the central nervous system is not fully developed, and in adults over 65, the central nervous system begins to deteriorate, which makes your body less able to cope with changes in body temperature. Both age groups usually have difficulty remaining hydrated, which also increases risk. Exertion in hot weather. Military training and participating in sports such as football or long distance running events in hot weather are among the situations that can lead to heat stroke. Sudden exposure to hot weather. You may be more susceptible to heat-related illness if you are exposed to a sudden increase in temperature, such as during an early summer heat wave or travel to a hotter climate. Limit activity for at least several days to allow yourself to acclimatize to the change. However, you may still have an increased risk of heat stroke until you have experienced several weeks of higher temperatures. A lack of air conditioning. Fans may make you feel better, but during sustained hot weather, air conditioning is the most effective way to cool down and lower humidity. Certain medications. Some medication affect your body's ability to stay hydrated and respond to heat. Be especially careful in hot weather if you take medication that narrow your blood vessels. These are known as vasoconstrictors. Regulate your blood pressure by blocking adrenaline beta blockers. Rid your body of sodium and water diuretics, or reduce psychiatric symptoms, antidepressant or antipsychotics. I mean, this blood pressure controlling medicine and some antipsychotic and other medicine which narrow your blood vessels can be dangerous for these patients. Certain stimulants for attention deficit hyperactivity disorder ADHD and illegal stimulants such as amphetamine and cocaine also make you more vulnerable to heat stroke. Then there are certain health conditions such as chronic illnesses such as heart or lung disease might increase your risk of heat stroke. So can being obese, being sedentary and having a history of previous heat stroke also increases your risk. Now I'll tell you the complication. Heat stroke can result in a number of complications depending on how long the body temperature is high. Severe complications include vital organ damage. Without a quick response to lower body temperature, heat stroke can cause your brain or other vital organs to swell, possibly resulting in permanent damage, death. Without prompt and adequate treatment, heat stroke can be very fatal. Now I'll tell you the preventions. A heat stroke is predictable and preventable. Take these steps to prevent heat stroke during hot weather. You should wear loose-fitting, lightweight clothing. Wearing excessive clothing or clothing that fits tightly won't allow your body to cool properly. Protect against sunburn. Sunburn affects your body's ability to cool itself, so protect yourself outdoors with a wide-brimmed hat and sunglasses, and use a broad spectrum sunscreen with an SPF of at least 15. Apply sunscreen generously and reapply every 2 hours or more often if you are swimming or sweating. Drink plenty of fluids. Staying hydrated will help your body sweat and maintain a normal body temperature. Take extra precaution with certain medication. Be on the lookout for heat-related problems if you take medication that can affect your body's ability to stay hydrated and dissipate heat. Never leave anyone in a parked car. This is a common cause of heat-related deaths in children. When parked in the sun, the temperature in your car can rise 20 degrees Fahrenheit in 10 minutes. It is not safe to leave a person in a parked car in warm or hot weather, even if the windows are cracked or the car is in shade. When your car is parked, keep it locked to prevent a child from getting inside. Take it easy during the hottest parts of the day. If you can't avoid strenuous activity in hot weather, drink fluids and rest frequently in a cool spot. Try to schedule exercise or physical labor for cooler parts of the day, such as early morning or evening. Get acclimated. Limit time spent working or exercising in heat until you are conditioned to it. People who are not used to hot weather are especially susceptible to heat-related illness. It can take several weeks for your body to adjust to hot weather. Be cautious if you are at increased risk. If you take medication or have a condition that increases your risk of heat-related problems, avoid the heat and act quickly if you notice symptoms of overheating. If you participate in a strenuous sporting event or activity in hot weather, make sure that there are medical services available in case of heat emergency. Now I'll tell you the diagnosis. It is usually apparent to doctors if you have a heat stroke, but laboratory tests can confirm the diagnosis, rule out other causes of your symptoms, and assess organ damage. These tests include a rectal temperature to check your core body temperature. A rectal temperature is the most accurate way of determining your core body temperature and is more accurate than mouth or forehead temperatures. A blood test to check blood sodium or potassium and the content of gases in your blood to see if there has been damage to your central nervous system. A urine test to check the color of your urine because it is usually darker if you have a heat related condition, and to check your kidney function which can be affected by heat stroke. Muscle function test to check for serious damage to your muscle tissue. that is known as rhabdomyolysis. X-rays and other imaging tests to check for damage to your internal organs. Now coming to the treatment. Heat stroke treatment centers on cooling your body to a normal temperature to prevent or reduce damage to your brain and vital organs. To do this, your doctor may take the steps which I am going to tell you now. Immerse you in cold water. A bath of cold or ice water has been proved to be the most effective way of quickly lowering your core body temperature. The quicker you can receive cold water immersion, the less risk of death and organ damage. Use evaporation cooling techniques. If cold water immersion is unavailable, healthcare workers may try to lower your body temperature using an evaporation method. Cool water is misted on your body while warm air is fanned over you, causing the water to evaporate and cool your skin. Pack you with ice and cooling blankets. Another method is to wrap you in a special cooling blanket and apply ice packs to your groin, neck, back and armpits to lower your temperature. Give you medication to stop your shivering. If the treatments to lower your body temperature make you shiver, your doctor may give you a muscle relaxant such as a benzodiazepine. Shivering increases your body temperature, making treatment less effective. Now I'll tell you some lifestyle and home remedies. Home treatment is not enough for heat stroke. If you have signs or symptoms of heat stroke, you should seek emergency medical help. Others should take steps to cool you off while waiting for emergency help to arrive. Don't drink any fluids while waiting for medical assistance. If you notice signs of heat-related illness, lower your body temperature and prevent your condition from progressing to heat stroke. In a lesser heat emergency such as heat cramps or heat exhaustion, the following step may lower your body temperature. Get to a shady or air-conditioned place. If you don't have air conditioning at home, go someplace with air conditioning such as the mall, movie theater or public library. Cool off with damp sheets and a fan. If you are with someone who is experiencing heat-related symptoms, cool the person by covering him or her with damp sheets or by spraying with cool water. Direct air onto the person with a fan. Take a cool shower or bath. If you are outdoors and not near shelter, soaking in a cool pond or stream can help bring your temperature down. Rehydrate. Drink plenty of fluids also because you lose salt through sweating. You can replenish salt and water with some sports drinks. If your doctor has restricted your fluid or salt intake, check with him or her to see how much you should drink and whether you should replace salt. Do not drink sugar or alcohol beverages to rehydrate. These drinks may interfere with your body's ability to control your temperature. Also, very cold drinks can cause stomach cramps. Well, I hope you like this video of mine about heat stroke. Till now, if you have not subscribed my channel, please subscribe it and click the bell icons so that all upcoming videos are delivered to your inbox straight away promptly. And if you think my video provides some sort of benefit to you, even if it is a little bit benefit, please like the video and share these videos with your family and friends. Not only with your family and friends, but also share my videos through social media such as Facebook and Twitter, because I want to help humanity all over the world so that maximum people can get benefit of my videos about different health related conditions. So now I think it's time to say goodbye to you because this video is getting a little bit longer. So see you in next video. Bye.